If you're looking for more romance in your relationship, you may want to have your hormones checked. Here with more is Dr. Clark Hansen from the Hansen Clinic of Natural Medicine. It's good to see you, Dr. Hansen. So you say check the hormones because there's not a problem with the romance, there's a problem with the hormones.
Well, we kind of wonder, life is so busy, hectic, stressed, and you're just thinking you're frazzled, you run out of energy, and yeah, you're getting older, but it's really the hormones. The hormone decline is what makes us older. It's that aging process, and if you rebuild that hormone level, you restore the romance. You actually restore that spark in your life, energy, mood, as well as your sex drive, but also those hormones protect you from heart disease and cancer. So it's really important to get them checked, and it may not be just a little thing. So this happens so frequently. I want to tell a story about a couple of patients.
Okay.
A couple, because it frequently happens. The wife comes in, she's feeling so great, then the husband finally says, whatever she's doing, I need to do.
Right. So you have an example with Paige?
Paige,
right?
Let's talk about Paige. She's 52 when she first came to see me. She'd had a hysterectomy at age 34 because she had endometriosis, infertility, uterine fibroids, ovarian cysts, real heavy menses. That's real heavy doses of estradiol and low progesterone. You need to get that fixed before you get a hysterectomy, and then you won't need a hysterectomy.
I see.
Afterwards, she gets all the symptoms of menopause, which are hot flashes, the night sweats, the fatigue. Then she's got everything else that goes along with it, the moodiness. She's just gaining weight, and she's not feeling good anymore, not like herself.
Sure,
so
which a lot of people write off to just getting older, but it doesn't have to be that way.
So we tested her hormones, and of course you'll see the first thing, she's got a real high estradiol. It should say H by that because that's really high, and that is caused because she was given an estrogen drug after hysterectomy. That's real typical, and that raises the risk of cancer. So there's safe estrogens, and there's not so safe. So we want to emphasize estriol, which is the good one. Everything else on there, you'll see all her hormones were low. We had to supplement all of them. In her 3-month and 9-month checkup, you see by the 9-month, everything's better. But within a week, she's feeling better. 2 weeks, she had no more hot flashes. Said her spark is back. She's feeling great. She's got energy she hasn't had in a long time. Within a month, she's saying, I asked her, how's your sex drive? She says, oh, yes. She says, finally, I'm feeling like I did when I was 35.
And then usually you said, then the husbands come in, because usually they need hormone replacement, too, of some kind.
Her husband says, okay, now I'm convinced. She's running rings around me. She's feeling great. She's looking better. She said her skin was softer. Her husband said, you just look better.
Gotcha.
It's part of the hormones. You not only feel better, but you look better. So her husband then, he said, I've got to come in.
Right.
So
what's usually
Bart
the issue with men with hormones?
This is really typical.
Okay.
Back pain, low energy, decreased stamina. They just can't run as far or ride their bike as far. He was a biker. Elevated cholesterol, low sex drive, and erectile dysfunction, and weight gain. Those are all so common. And look, they're all due to low testosterone pretty much, or low growth hormone. Both those decline as we age. So we tested his hormones, and you can see his testosterone at the initial lab there, that second row down, 290. It should be 800.
Oh, wow.
You want to get it up to 800 on a level of a 35-year-old, a healthy, safe level. You don't want to be an exaggerated, real high level. Bodybuilders often do 10 times more than they should, and that's where it gets a bad rap.
I see.
But men need their testosterone, so does women. Woman needs 10 times less than a man, but they need it as well.
But they still need some.
And you need the full complement to make it work. You need all the estrogens, but you need them in the right balance. You need the progesterone.
Sure.
And you get them balanced, and then all of a sudden you feel great. So Bart, not only did he feel great, his energy was back, he had that spark back. This connection, this bond that you used to have as a couple, it comes back. And you really do feel just awesome, and you have this attraction to your wife and your husband, and he was having better times. He cut 90 minutes off his bike course time, and he lost 20 pounds.
Wow. And is it dangerous for a man to have low testosterone?
It is dangerous. I think we have one last slide that shows all the things that can happen. You've got to go to the website and see this. You need to keep a man a testosterone level above 700, or you start getting thickness of your arteries, high blood pressure, increased risk of cancer, Alzheimer's disease, decreased cognitive function. If it's below 300, you're going to get increased risk of prostate cancer, depression. So it really needs to be checked, and you got to get it up to the optimal level.
And I'm sure a lot of people can relate when they see some of these charts, like, yeah, that's how I've been feeling. So for people who are watching who want to make that next step and get their hormones checked, do you have a special offer?
We do. We want them to go to the website and learn more information. Read all the stories, because you'll see yourself in those stories.
Yeah.
And you can see the details. And if you sign up for our newsletter, you'll be entered into a drawing to win a free hormone test. We'll give away 2 or 3 of these tests. It tests 4 of the key hormone, or 6 of the key hormones that you need to be testing, and then come in.
Yeah.
You got to get yourself tested, and it's just so worth it. Everybody says it is so worth it. I feel, why did I wait?
Why did I wait?
It is so great.
Feel better sooner. Thank you, Dr. Hansen.
You're welcome. Thank
Lots
you.
of information there. So if you would like more about the Hansen Clinic of Natural Medicine, please go to drhansen.com, or you can call the number you see right there on your screen.